I guess for me, being a nurse is just, I feel I'm really fortunate because I get to help people out every day, and that's what I feel passionately about doing. I love helping.
It made me a better person. I was more responsible and more thoughtful, and I always liked children. I just think they're the most magnificent creatures on God's earth. They're just beautiful, even when they're being little rascals.
I have enjoyed every part of what I've been doing, the good, the bad, the ugly, the sad, the happy. The more you give, you don't realise that how much you're getting out of it, which gives you the stamina to give more. And working with children, I think that it's always the joy that they have, the expectation that things are going to be bigger and better and brighter. And so we look at the positive side all the time with children.
Being able to provide the same level of care that I would expect for myself and any of my family members to other people, and being able to go out of my way to make their stay as comfortable or fun as possible, which means that sometimes I might have to act like a bit of a fool, but it gets the job done. As long as my patients are smiling by the end of the day, that's all that matters to me.
I just absolutely loved it. It was just the best thing that I could have done. I'd always wanted to be a nurse, and so this was a fulfilment of that dream. Yeah, and I love what I was able to do here. I love working with the children, and I think too, I love working with their families and knowing a little bit about them. I loved coming back to PMH. It just, yeah, it was like home, second home.
I felt very much at home. I had always wanted to be a nurse, and also the thing was that everybody made you feel welcome. There's just something about PMH that draws you back to this beautiful hospital that I have absolutely enjoyed.
So I find it satisfying because we get to meet that need, which seems to be some inborn need in me to help people. So incredibly satisfying. And to see those children get well and go home is just so rewarding.
I came back here after we retired and did volunteer work for 22 years. I didn't know it then, but now it was my life, really.
I guess being able to embrace your inner child and sort of relate to the kids, teenagers, in a way that makes them feel more comfortable with being in hospital, that's fun. That's fun for me.
Because I don't believe that you can work with your patients unless you really have an affection for them. That's how you give them the best that you can. Taught me that this is life, and you've got to get on with life even though there are going to be hurdles, and that's, you know, that was really quite a huge learning curve.
I feel passionately about the power in healthcare being with the health consumer, not the health provider. So I don't think any family wants to be here, and I think it's really important that we listen to parents and that we're kind, approachable, friendly.
I think as nurses, the job being as tough as it is sometimes, we really do tend to stick together and sort of help each other out and make sure everybody's happy. We really, we support each other through the good times, the bad times, the ugly times. And we have a lot of fun together.
The relationship with the girls that you work with, your colleagues, we still meet, we still are constantly in contact. They're very much part of my family.
It was better than you ever expected, the life, the journey at PMH.